Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Today, I'd like to start off by saying thanks to all of you who are following the three W's, showing an IQ, and practicing the golden rule of gathering. And if you aren't sure what I'm talking about, go back a few videos and check it out. I was out and about some last week, and I saw so many businesses doing their part, so thanks to each of you. Today, in Part 8, let's talk about the doctor. Now, I'm not referring to what healthcare organizations and offices in the hospital have been doing, but I can tell you what they've been doing has been mighty good work on behalf of all of us. What I want to talk about is using the doctor and the hospital, and what we know now, a couple of months into since all this started. Offices have been taking significant precautions to protect you as well as their staff, and the hospital has done a really good job of being prepared and taking care of non-COVID related issues as well. To date, there have been no cases connected to healthcare workers at the hospital here in Haywood County. The hospital is again doing elective procedures following a very careful protocol, and to date, no one, as part of that protocol, has brought COVID into the hospital. So what this means is it's okay to connect with your doctor. If doing so by phone or video conferencing is working, then stay with it. But if you or your doctor feel an in-person visit is the best way to address your issues, then you can feel more comfortable going there. Certainly maintain your vigilance and expect others to do the same. That hasn't changed. And what about kids getting their immunizations? I'm not talking about whether you think immunizations are the right thing to do. That's a whole different topic we can talk about sometime if you like. What I'm referring to is that many families have been reluctant to go to the office for this because of concerns about exposure to COVID. What we know now, a couple months in, is that going to the office is okay. At this point, the alternative is a loss of herd immunity in our community, leaving many children at risk for diseases they don't have to face. And if you ever saw some of those illnesses, like meningitis, facial cellulitis, measles, diphtheria, polio, well, having seen some of these early in my career before some of the vaccines were available, I can only tell you how devastating they can be, and your child does not have to endure that. Also, the isolation so many have and are enduring on so many fronts was a necessary part of the hammer phase. Now, here in the dance, we must balance the risk of COVID associated with greater contact with others against the risk to our sense of well-being, economically and emotionally. Nobody has said, or ever said, we can eliminate our risk, but we can surely lessen that risk, even with COVID. And you can do that by taking the precautions available to be as safe as possible for you and for others. And if you're struggling with how it's all going, feeling like there's no way out, it's okay to reach out for support and help. I can assure you there are always options. There are resources available to support your well-being. And if you're concerned about a friend or family member, just ask. Ask them how they're doing. It will make all the difference. Part of surviving this reopening and dancing gracefully is maintaining your vigilance and paying attention for yourself and for others. We had to be focused on COVID, and the risks with it are far from over. But our dance steps must now also include getting the care you need, because not every health issue is from COVID. There's no reason now to put off your health care needs. I think what we have learned to date tells us now is as safe as it gets, for now. So be vigilant, continue to follow the three W's, show an IQ, practice the golden rule of gathering, get the care and support you need. It's okay. So be well, be careful, especially right now.